Good afternoon to everyone. Yes, so my presentation is on declining HDL-Cholesterol among PLHIV post-dolutegravir initiation in Ghana, a risk factor for coronary artery disease. So coronary artery disease is the leading single cause of death worldwide, and there's reported increased risk among persons living with HIV compared to the general population. And low HDL has been reported as the single independent risk factor for coronary artery disease. Since the rollout of dolutegravir, there have been reports that have associated it with dyslipidemia, but there are conflicting reports on HDL. So Ghana rolled out DTG for the first time in 2019, and in 2020, we commissioned a study to be able to monitor the outcomes of this new treatment among our patients. So this study assessed the levels of HDL amongst our patients after 18 months of treatment. We conducted a prospective study, which was an observational one, a multi-center facility-based one, among adult PLHIV who were 18 years and above, and who had no dyslipidemia at baseline at the start of initiation of dolutegravir, and their HDL levels were also normal. And HDL levels were measured after a post 12-hour fast at baseline, and then the same thing was done at 18 months. And abnormal HDL was defined as HDL levels less than 1.68. What did we find? We had 1,125 people who were recruited, and of them, majority were female. But in 18 months, 77.5% of them had developed abnormal HDL, with the confidence interval stated there 74.5 to 80. When we look at the change in the mean HDL levels, and so you look at it from baseline, prior to them starting the dolutegravir, before they were initiated, the mean HDL level was 2.5. And then by month 18, this had reduced significantly to 1.4. And with the significant predictors being overweight, being obese, and then being ART naive at the time of start of DTG initiation. So in conclusion, we say HDL levels reduced significantly by month 18 in our patients, and increasing BMI and being ART naive predisposed them to having low HDL, and PLHIV people on DTG, they are at increased risk because of this, and therefore needs to be keenly monitored. And we need research on longer-term HDL trends and DTG outcomes. I want to acknowledge people from all these institutions who made the study possible, and also want to thank Interest very much for giving us the opportunity to share our findings. Thank you very much.